Dead on 1 o'clock as well. Good afternoon, everybody. Welcome to today's webinar. My name's Nathan. We are looking at the managing infections and improving antibiotic prescribing. So we're going to go through some of the resources for that in this webinar. And just so you know, this is all for SystmOne practices. So the EMIS webinar was last week. So if you are an EMIS practice and you're sat watching this, then by all means you can stay for like the first bit and everything. But we can always put the link of that webinar in the Q&A if you need that. So yeah, that was done last week. So I am Nathan. So I'm the training specialist lead for Ardens SystmOne. So I'm going to kind of be talking about some of going through the resources in SystmOne. But I just wanted to introduce you to a couple of my colleagues as well that are helping me on the webinar. So first we've got Charmaine, who is head of training at Ardens. So she'll be sat on the Q&A, just answering any questions that you might have. I'll be ignoring the Q&A while we go through this, and I'll be doing the presenting, but she'll be manning that. And we've also got Dr. Emma Tate from the best practice team. So she's one of the doctors that was kind of driving these updates in the system. So again, Emma will do a little bit of a talk at the start, but also manning the Q&A and in the background. So they'll be manning that, and I'll be doing most of the talking. So I think we'll probably just get onto some housekeeping first, as we always do on these webinars. So on the next slide. So again, you've probably joined these loads and you know the drill by now, but just so you know, because the kind of the format of these webinars, your cameras and microphones are turned off, so we can't hear or see you. At the end, and we'll talk about this in a bit, we'll probably do a little Q&A. So if you do have questions, we can unmute you and you will be able to ask that. But we'll do that at the end once we've kind of gone through all the resources. So yeah, but do please ask those questions on the Q&A. So you'll see the Q&A button. You're probably all au fait with Teams now anyway. So click on that and Emma and Charmaine will just be manning that and we'll be able to kind of answer. We'll also provide some links and things in there as well if you need them. So it's definitely worth just having that pane open. Won't take any more than an hour this session. I appreciate you all probably want to, you're probably eating your lunch now, but no more than an hour to do this. And if you do have to drop off, or you've just got a colleague that you think would be really like this session, then this is recorded. We do email the recording out to you all once it's been done, but it's also provided on, we'll give you some resources at the end, but it'll be linked to our recorded webinars page. So, and they don't expire either, so you can watch these back whenever you want. And then, as we always say, if you do have audio issues, it's working at our end. So just do a quick, if you turn Teams off and back on again, it usually helps if there's any problems there. So yeah, just kind of like your standard housekeeping. So moving on, we'll just have a look at an agenda of actually what we're going to cover. So firstly, just going to talk a bit of background about what these resources are and kind of, the background behind them and kind of why we built them and updated them really with regards to SystmOne. Again, I'll talk about that in a minute. Then kind of how we can help with kind of your infectious diseases and your antibiotic prescribing. Then I'll dive into SystmOne and just do a live demo of a couple of the templates just to show you exactly where they are. And then we'll just kind of move on to like the open Q&A. So if you do have questions to say, do ask as we go along, but we can open it up if you've got any specific ones. And then lastly, we'll just talk about kind of next steps to do with training and Ardens Academy. And, we've got loads of resources, training's always available, and we'll talk about that at the end with kind of, emails and links to that as well. So, kind of everyone learns slightly differently. So, we have this webinar, but there's loads of other ways, support articles and stuff. So we'll talk about at the end. So, kind of talk about, kind of dive into this. So, we kind of know that with kind of AMR, it's kind of a challenge for kind of everyone really, especially as kind of people kind of get it gets harder to treat as kind of with regards to kind of the prescribing of antibiotics. Now, that obviously then has, as bodies become more resistant to it, that has an impact on patient safety. And then obviously then that would then be pressure on kind of the healthcare system as well. Now we know that part of the NHS long-term plan is to kind of tackle this area. And one of their priorities is around reducing antibiotic prescribing. So kind of a lot of you might be signed up to our kind of monthly bulletin, and we sent one out last week kind of regards to kind of how Ardens can support this. Now, if you're not on that bulletin, then we can kind of let us know in the Q&A, and we can give you details about how to sign up to that. I imagine a lot of you are, though, if you're kind of on this webinar. But we sent an email out last week around kind of the resources that we produced to help with this kind of NHS long-term plan. So, those things are, standardizing that clinical care. Now, you all know, you're all using Ardens. We do that anyway. These templates kind of ensure you're all kind of following that nice guidance and best practice, and standardizing your consultations and making sure that you're kind of doing it with all the relevant information. So, that's one of the things, is using the Ardens templates. And then obviously, improving your antibiotic prescribing. So in SystmOne, again, and all of our templates, you've got those embedded formularies. So, this makes sure that you're choosing kind of the first choice antibiotics, and, prescribing when you need to prescribe them and not just prescribing them all the time. So again, they're built into that, and again, Emma will kind of talk a bit more about around that in a minute. And again, as with all the Ardens resources and all the templates, we've all got that kind of embedded patient information as well, with regards to kind of leaflets, and we've done some quite cool stuff on the newer templates that we've built, which I'll show you in a minute, with regards to sending leaflets out to patients and things. We've kind of made that even simpler, to make sure that kind of patients are getting the up-to-date information, and they're getting it easily. And obviously we've got loads of other resources which we're not really going to talk about today, but kind of like, to reduce the infection rates. So all of our recall reports in the background with regards to kind of all your vaccination programs, this can make sure that we reduce that infection in the first place. So, we've got loads of resources to help you kind of recall and deliver all of those vaccination programs as well, whether it be childhood or just adult immunizations. And as you're probably all using our flu resources as well. So again, they're all already in Ardens, and you're using that. And a lot of you are probably using Ardens Manager as well, which is our kind of population health management tool. So obviously in there, we're kind of empowering practices with kind of the dashboards and those reports to accurately kind of look at that data, not just at a practice level, but an ICB and a PCN level as well, with benchmarking. You can really dive into that information a lot more than you can in SystmOne, and all of that's kind of being uploaded automatically, and it just means you can kind of track performance and see how you're doing in all of those areas. And we will be building some kind of stuff around the infections templates as well, which again I'll talk about in a minute, with regards to that. So this is all on that bulletin that we sent out last week, but those are some of the ways, and I'll dive into the resources in a minute. But just to kind of talk about these resources that we've updated, just to start us off, I might just hand over to Emma just to talk about what we've produced, and then she'll hand over to me and I'll do the live demo. So Emma, I'll get the next slide up for you.
Thank you. Thanks, Nathan. So hi everyone, I'm Emma. I'm a GP and I'm in the clinical team at Ardens. So we all know infections are one of the most common reasons why patients come to see us, but we recognise that there is a huge variation in how the patients are assessed and managed. So that's the real reason why we wanted to improve upon the existing templates that we've already got in SystmOne, and we wanted to make the consultations and management more comprehensive, more efficient and safer ultimately. And Nathan will guide you through the structure of these templates a bit later on. You'll see that the layout we think is a lot more streamlined. It's got clear traffic light colour coding in the impression section, and that can help a clinician to quickly assess the severity and risk of complications that patient has, and in turn that will decide on the correct and appropriate management pathway for that patient. Some of the templates you'll see a bit later on, they'll also include follow-up pages to reassess the patient if they come back to see you, and that may be after a result comes back. And we'll show you some examples of these. And because the documentation in these, and the coding is standardized and consistent throughout all these templates. It supports auditing, reporting, quality improvement, and essentially consistency of care. We are currently, talking of auditing, we are currently building and improving on our reports, and we've got a lot of antimicrobial searches and reports that are in process at the moment. So we'll be releasing a full suite of AMS resources soon, which is really exciting. I'm going to hand you back to Nathan now, who will walk you through how to use the resources. But obviously, any questions, let us know and we can try and help out. Okay, thanks, Nathan.
Thanks, Emma. Cheers. Yeah, so just before I dive into SystmOne, just wanted to talk about kind of what we're going to look at. So kind of the delivering of this with regards to using the templates. So, I'll give you an example of some of the acute templates and some kind of scenarios there and kind of built into those templates, allows you to do that kind of acute consultation to make sure that you've kind of almost done the perfect consultation with all the resources at your fingertips. Where appropriate, there might be follow-ups, as Emma said. So, if you need to follow up off the back of it, we've got a separate page for that on the templates where that's relevant. So I'll give you an example of that. Embedded in all of them is the formulary to just give us that advice on exactly what we should be prescribing and if we should be prescribing. And then we've also embedded a lot of kind of the referral criteria around some of those things. Do we need to refer this on? And what's the criteria to do that? And again, also on each template, we've got those resources embedded. So I'm going to be covering those bits. One thing it's just worth noting is with regards to kind of auditing all of this, at the moment we are in the pipeline are a load of reports that will help us with this as well as a kind of a dashboard and Ardens manager. So, this will help you kind of like dive into kind of what you have done and, how are you doing with regards to prescribing your antibiotics and that sort of thing. So that is something that we're building currently. We will update you. So again, just referring back to that bulletin, we'll update you on the bulletin when those resources are available. And I'm sure we'll probably do like another webinar and have kind of a support article and that sort of thing for all of this as well. We have done a support article for these templates, which I'm sure if Charmaine hasn't already, we will put in the Q&A. Think of that as like your little guide to everything I'm about to show anyway. But obviously we'll update that when those kind of audits and dashboards are in place. But today we're going to be kind of looking at the template. So I'm going to dive into SystmOne then. So let me just close this. This is always and it hasn't locked out. No, perfect. Okay, so I've got my SystmOne open, so hopefully you can see that okay. So just a little caveat, obviously I am using a test patient. So some of the information, we use it for all sorts, but the actual using the templates is exactly the same here as it would be for all of you at your practices. And I think I kind of mentioned at the start, a lot of these kind of infections templates, they aren't new for SystmOne users of Ardens, but we have kind of, obviously, as Emma said, we've updated them with the latest guidance and, we've kind of improved them slightly. So, kind of, they're really, really useful. But those that might have had training by me, I might have shown you some of these things already. But again, a lot of people still don't know they exist. So it's very good to kind of go through them. So where do we get to them? So there's a few ways you can get to the templates. I'm going to go through the quickest and the easiest way to start, but once I've gone through them, I will show you how you can kind of embed it into kind of current processes that you might be doing using Ardens. But basically, we've got our patient open. As we all know, we've got the name in the top right. And, normally you have all of the icons under the patient's name telling us what's going on with the patient. So, that's all the same with regards to Ardens. But for those of you that are using Ardens, as you're probably aware, if you use the F12 launcher within SystmOne, we can bring up, and obviously it's always good to do this when you've got the patient open, we can bring up what is known as the launcher in SystmOne. And basically all this allows you to do is search for any template that exists, and that's not just Ardens templates, that could be local templates or national templates that are built as well, but all of the Ardens resources can be easily found using this launcher. Now, as you can see at the moment, we've got all sorts there. You'll also notice on the left hand side I've already added some favorites, and I've added some of the infections templates already just to help us. But basically what we can do is in the search box we can search for the template that we want. Now, just before you do that, and this is just a little of a training thing, but I always think it's worth practice knowing this. It doesn't matter if you don't do this, but it makes it easier. Underneath where you search, there's 4 tick boxes. Now, by default, they'll probably all be ticked when you first press F12. I would, just to make it easy to find what you need to find, I would untick them all except the one that says show templates. It just stops any duplications and it just shows you the templates and nothing else. So just a little tip. I say it doesn't matter if you don't do that, but just a little useful kind of tip to make this easier. Now, if I was clicking in, let's just say a patient came in and they had an acute cough and I want to use the infection template for acute cough. Simply put, I could type the word acute. That would find it. I am going to type acute cough though, just to show you exactly what I mean. And then I can either hit return or click search, and it's found our acute cough template. Now, just another little tip for those that don't know, if you had, I mean, it's very unlikely with this, but if you had more than one option and you're looking at going, well, which one's the Ardens one? I mean, to be honest, all of our templates for the infections has this little icon anyway, so you'll soon get used to it. But if you hover over the icon to the right, it will tell us that's an Ardens template. As I say, you probably won't need to do that, but it's always a good tip for any of our templates if you're not sure. And then what I can do is I think, well, actually, I do a lot of acute coughs. Let's just save that as a favorite. So I can click and drag that over and I can basically drop it anywhere on this side. I'm going to drop it there and I will add it along all the others that I've added. So very quick, easy way of finding these templates to kind of start with. What you will notice as well before I dive into the templates is at the top, I've added one literally called infections. Now, you don't have to use this one, but what this template does is it shows us all of the infections templates in one little dashboard. So I think in reality, when you start using these, you won't need to come to this. But I think just to start off, if you just want to have a play after this and just see what's there, I would add that to your F12 and just see and have a look, and you can kind of get au fait with these templates. So I'm just quickly going to double click on that one to open it up. So I'm not going to go in this way, but I just wanted to show you, look, we've got all sorts. Now we've updated some of these are stuff that's been in there a while. The ones I'm going to show you is the stuff we've kind of updated, and we're expanding on this all the time, but there is a lot of useful kind of templates that you can use there. So if you did want to see what's there, you can go that way. I am just going to close that though. But let's just say we're going to do acute cough. If I press F12, I've now got it on my F12 favorites list, and all I need to do is double click to access that template. So I'm just going to do that now. And we get our template come up. Now, again, if you're all using Ardens already, you're probably used to this kind of home screen that we have on all of our templates. What that home screen is doing is it's giving us kind of like a quick overview of what's been going on in the patient already. So rather than us having to go to the journal and scroll through lots of consultations, we've kind of collated useful information about this patient. Now, again, caveat, my test patient is probably not the best example with regards to a full clinical history, but you get the idea. And what's really useful here is it's going to show us any other infections this patient might have had in the last 5 years, because that might inform our decision of the consultation we're about to do. So if they've had lots of UTIs or lots of acute coughs, then we might think, well, actually alarm bells are ringing here. So it's a really useful tool. It will show any other time that has been coded. It will show you there. And then just other things around kind of, I mean, this patient's random, but, are they on any high risk drugs? What allergies and sensitivities do they have? It'll also show me exactly what other medication they're currently taking. As I say, you don't have to spend long on this page, but it's just a nice snapshot that might inform you before you do your consultation. And the only other thing to say about this page is the medication here is interactive. So maybe we were doing this consultation, but before we do it, they might say, oh, while you're there, can you prescribe me my repeat? It is possible to right click on here and I can issue, or I could stop or reauthorize from there as well. So just a little bit of functionality you might not know you can do on those home pages, you can. But you'll notice across the top, we've got our tabs. So we're on the home, but we've got acute, formulary and resources, same down the left-hand side. So if we go, so we're going to do an acute first. We're going to do acute consultation. As I say, in a minute, I'll show you another one where there's a couple of extra tabs depending on what's going on with the condition. But this is a nice one to start with. So we're going to either click that link there or the tab at the top, and they go to the same place. And this is where we can do our consultation. Now, these are great because they just guide you through. And, I was talking to Emma before this call about this, and, I always say, I've got a good idea of what I would say to a patient if they came with an acute cough. And I have no medical training. I mean, obviously I would not do that, but it gives me a nice idea of kind of, what would be the right thing to say and what to look for. And if that makes sense to me with no medical training, and obviously it's going to be even better for those that you do have that. So they flow in a really nice way. Now you'll notice, just like all the other Ardens templates, they have like this assessment section, impression, and then management. So the assessment bit is, patients in, start chatting with them, nice and easy. All we need to do is select, do they have a cough? Yes, no. Fever. So it's kind of prompting me for the things I should be looking for that would be associated with an acute cough. Again, I'm almost teaching you to suck eggs with these ones. It's kind of very simple. So, cough, fever, breathlessness, you can say yes or no to those. You've then got your free text boxes. What other findings are there with regards to this patient coming in? Any other risks and signs of complications? Now, you can free text in there if you wanted to put a little narrative. But what I find really useful, and I remember the first time I saw one of these templates a while ago, and I thought, well, I wouldn't know what to put in there, when I was thinking about this. But what you'll notice is to the right of each of those free text boxes, you've got this icon. So it's like a bit of paper with a green plus. Whenever you see that in SystmOne, it means like preset text. So if I actually click on that to the right of findings, we've actually got the sorts of things we would be looking for, and we can preset it into that box to save me having to type it. So, what's this associated with? Okay, so they've got mild constitutional upset. And if I hold down control on my keyboard, I could choose, and they've also got a dry cough. So I could select all of them. I can select whatever I like. And whatever I've got selected, at the point of then clicking OK, it will then go into my findings box. So again, it's prompting me to what to look for, and I can add it to the patient record. So you're kind of standardizing and doing a nice, neat consultation. Anything put in previously as well, you can kind of see on the right-hand side, which is very useful in the date. So, the more you use these templates, and the more, you're going to get a good idea of, oh, they came in last week and they had something similar, because you will see that data on the right-hand side if there's any historic things put on there. Next box, are there any risks, signs of complications? And again, I'm not quite sure, but if we click our preset button to the right, it tells us. So again, on both of them, you've always got that option at the top, which is absence of high risk features, because it might be that actually, yeah, they've got this, but they're fine. So it's prompting me, but I have that option to say I've considered that. Now, obviously, if I did absence of both, in both, then you might be thinking, well, do they actually have an acute cough? But we could say that, or we could say, no, actually, they're over 18, they've got diabetes, or, they're immunosuppressed. So we can choose any of those, and we would click OK. And again, it goes in. So again, nice and simple. And then, are there any other causes considered or excluded? So it's kind of prompting, could it be cancer, that sort of thing. So, I do have links on the right-hand side to the lung cancer template or the pulmonary embolism. I always got that first time right then. So those two templates, if I wanted to know what the referral criteria would be for those kind of those types of cancer or those sorts of things, that would give me that criteria if I wanted to. If I'm happy, I'm going, no, I'm quite happy it's not cancer, but I can access it there. And if you're doing any point of care testing, I can also kind of code that here if I need to. So, a nice streamlined consultation. And again, you'll notice on the right hand side, we've got our standard boxes to add temperatures and blood pressures and heart rates, etc. So again, depending on what the patient's presenting with, we can add that on the right hand side. And again, just like everywhere else, if I click in each box, it will show me a history of all their other ones. So we can see what their blood pressure's been doing in the past, and etc. If you do need to add any more vitals, you've always got a link to the vitals and lifestyle template by clicking that button there, which will give us kind of basically any other type of thing that you might want to add opportunistically. So you've got the resources if you need them. But once we've done our assessment, we've then got our impression. Now, what's really nice about these templates is you can't really go wrong with regards to kind of the advice we're going to give them, because at the moment, if you notice in the management, it's pretty much all grayed out. So I can't tick any of these because we haven't said what's going on. And we've got that traffic light system that we kind of already mentioned. So we've got green, amber, red. So depending on what I've put on here, I can then make my decision. So I'm just going to give you, I'm going to show you what happens on each option, just to show you. So if after I'd spoken to them, it was an acute cough, but they were systematically well and there was no high risk of complications. Notice when I tick this one, underneath, it's now only lit up what the advice would be with regards to that impression. So in the case of that one, all I would then do is go, right, okay, so, yeah, you've got an acute cough. It lasts up to 3 to 4 weeks. So, I can tick to say, that's what I've advised them. Make sure you're getting lots of self-care, fluids. You might want to, taking honey, these are over-counter options, etc. So again, just giving them that kind of information. And then what's really useful here is there's some links on the right. So we've got our resources link or target RTI. So if I click on this link here, what it's going to do is it's going to open up that respiratory tract infection leaflet that we can give the patient. And, I could put the link in AccuRx, or I could text it to them, or I could print that, however you want to do it. Again, depending on what you do at your practice, but we've got access to that nice and easily. From within the template, and because there was systematically well, antibiotic is not indicated. I can't tick to say give them the antibiotics. Follow up discussed. Review if it gets worse. Better after 3 to 4 weeks, and then the plan would just allow me to write anything else that I've told them, and anything else you want to add. So straight away we've got that nice kind of consultation. It's documented everything. It's really good record keeping, and it's all based on that that nice guidance, and we're that informed kind of consultation. Now that's easy, that one. But if I've unticked it, so it's unticked all of them now. So let's just say actually they're systematically well, but there is a high risk of complications. So if I tick that, now a lot of the options are going to remain the same. So advice on the condition and self-care, but we've now got the option to say either give them the backup antibiotic if symptoms worsen, or antibiotic is indicated for immediate administration. So again, as a clinician, you can make that informed choice, and we could tick either of those to say that's what we're going to do. Everything else is kind of, very similar with regards to the advice you're giving them. But what's nice here is, again, you've got the link to the right. So let's just say antibiotics are indicated for immediate administration. Tick that, click the formulary link to the right of it. And all it's done is, if you notice at the top, it's taking us to so we're still in the same template. It's just taking us to the formulary page of that template. And it's basically telling me what I should be prescribing for that, for an acute cough. So again, I've got a good idea of what I would give here. Before I talk about that, just worth noting, underneath this screen, like all of our formularies, will show me what allergies they've got, medications they're currently taking, so I can view that from there. But to keep this nice and simple, you'll notice as well it's divided it by age. So we've got 18 years and over, or 1 month to 17 years. So again, depending on the patient's age, I could choose the relevant ones. And I know, they're over 18, first choice is doxycycline, but if they were pregnant, I'd want to be looking at one of the alternatives. So the preferred choice in pregnancy would be amoxicillin. We wouldn't want to give them that, etc. So again, you're, as a clinician, it's giving me that information at my fingertips, or the same for that. And what's really nice here is if I click, doxycycline, click that, then it's telling me what to issue. So, 200 milligrams OD for 1 day, then 100 milligrams for 4 days. They're over 12. And that button there would prescribe that drug. So that's doing, so essentially, rather than you having to go and click acute, search for that, what's the correct date, or what is it again, type it all out, click OK, we're literally going, that's the drug you need, press the button, and then obviously you would send it electronically or print it out depending on whatever your practice policy is. That's no different. We're just streamlining it. And I'll show you anyway, if I click that, it will pop up with any patient specific warnings. None of that is any different to what you currently use in SystmOne. It's literally just, prompting you to do that. I'm going to say do not proceed. I'm not going to prescribe it, but you get the idea. So again, it's giving you all that information. Now, I'm just going to click back on the acute tab. I'm just going to talk about, essentially that's it. And again, you could put in the plan anything else you want to do. So I'm kind of hoping that makes sense. Now, before I kind of move on, the only other thing I wanted to talk about on this is, once you've kind of gone through this, is you've also got a link to the resources. Now, we can get to it back on the acute page, or you'll notice there's a resources tab at the top. So again, all of these templates have the same format with regards to this. So if I click the resources tab, we've actually got some, and again, like we talked about at the start, that patient information to kind of give them that kind of guidance. So now, before we used to have the link and you used to have to copy it and put it in Accurex or text it and do whatever you want. We've still got the link on there, but if you're using SystmOne's communications annex, let's just say I want to send them the cough kind of leaflet. If I click on this button, it pre-fills your communications annex with the text and a link to the leaflet, and it's also going to code it. All I'd need to do is click send, and that will text or email it to the patient depending on what preference the patient has. So you don't even have to worry about what the link is or copying and pasting it. We've kind of taken it a step further. So this is really nice. I like this bit because before you'd had to copy it. So, you know, or we've got no preset message and then you can paste anything else in that you like. So again, a really easy way of just being able to text the patient or email them links to resources about the condition they've come in with. You'll notice there's links to like professional guidance, etc. underneath as well, if you do want to kind of access that as a clinician. But essentially, that's kind of like a nice little kind of run through of that. I will show you a couple of other ones, but I might just check with the guys if there's any questions with regards to any of that. Anything on?
Yep. It's just really to mention that we're having trouble adding the links to the support article to the Q&A at the moment, but please don't worry, because we will email out that, like Nathan mentioned, we'll email out the recording plus the link to our support articles as well. But to be honest, you can find them all on our website, and we're at the end we maybe just show you where you can find those, just in case we have any more trouble. We have had a question that might be worth discussing, and maybe probably one for yourself, Emma, and that is around the target leaflets. And it was mentioned there that it'd be really good if it was more editable, say that right, version, rather than just a PDF. Is that something that we are considering doing at some point, do you know?
Yeah, I think, yeah, correctly. The ones that we've got are just the PDFs. If the editable ones are available for us to use, and if there's a link that we can link to, then we can absolutely look at adding those if they'd be more helpful. So yeah, if anyone has the link, then please feel free to email into support at Ardens, and we can review that for you. That'd be great.
Thank you, Emma. I think that's it for now, Nathan. Thank you.
Yeah. I saw someone did put their hand up, but I think we'll leave that at the end, whoever that was, and we can open up the floor then. Yeah, unless you put it in the Q&A, and then we can answer it as we go along. Perfect. So, I mean, the good thing about these resources is once you've seen one, they kind of all flow the same way. So they're very, very good to kind of start using. But just wanted to show you a couple of other ones. I'm just going to come out of this one. So I'm just going to go back to my F12. So just again, patients up, they've come in, press F12. And I was just going to go through the sore throat one next. I've already got them set up, but obviously if you didn't have it, same thing again, you would just type acute, and I'm just going to type acute sore for now, click search, and it would find our template. But as I said, I've already added it to my favorites list. Double click on it, and you'll see exactly the same front page. So we don't need to talk about that. It's exactly the same as what was on the last one. The only thing I just wanted to make a note about this one is a couple of extra tabs at the top of this one. So again, we've got our acute consultation, but we've got a scores tab and we've got a referral tab for this one. So just a couple of extra things that I'll quickly go through, but I won't spend as long on this one because I think you'll get the gist. So again, we'd start our consultation by going to the acute tab or the link on the left. You can see it's very similar. You've got that assessment bit where, you know, have they got a sore throat? You know, if they got a fever? We've got our findings, we've got our risks, signs of complications. So again, you know, without, you know, going into it in too much detail, again, there's our presets for the findings. And again, do have a play with this. You don't really need to see me go through every single option again, but, you know, and there's your presets for, you know, so again, it's just clicking the icon to the right of each one to get these presets. Just an extra thing here is obviously, you've got the ability to do your scores. So you have the tab at the top, or again, this little blue link here. So, you might do this and we might do the fever pain. So if you click the link to the right, it's going to take us to the scores tab, and we give you the choice. You got your fever pain or Centaur or, etc. So, and we could ask these questions to the patient, have they had a fever in the last 24 hours? Any pus on the tonsils? How long have they had this for? Mild inflamed tonsils and mild cough or cold symptoms. It gives us a score of 1, and then that basically gives us the likelihood here of, and whether they need antibiotics. So, very much, again, you're documenting that in the patient record. So you've got the evidence to show, well, this is the reason that I came to why I did not give them those antibiotics. So, covers you back. It's good record keeping, nice and easy, and you can make that kind of choice. So, again, that was just on that tab. And again, if you find yourself on this tab and want to go back to where you were, just go back to that acute tab and we can continue with the consultation. So again, the link to the scores on this one. And again, look, without going into too much, once we've done that, it was a score of 1. So I'm going to tick that. So again, we actually have a drop down to say, because there's a couple of things it could be. So we can say, it is, maybe it's acute tonsillitis, but then again, the advice, very similar, this is what you've got, this is how long it's going to take. And, we'll send you a text about some of this, with some leaflets, some self-care, again, that self-care advice. What is it that we should be kind of, suggesting? So it kind of gives you that ticket to say you told them that. Antibiotics not indicated because I've ticked that option, etc. So again, it's very, very similar, isn't it? It kind of goes through that depending on what you put your answer in. But again, if I do one of the other ones, with the traffic light system, this time it's going to let me do the backup or antibiotics. And again, if I click the link to the formulary, it then takes me to the formulary page. And again, if I'm clicking on that, it's then going to, now just again as an example, first choice penicillin in this instance, we've put a couple of the different doses. So again, this is all based on the national NICE guidance. In the case of this, I would make a clinical decision. Do I want to give them 500 milligrams for 5 days or for 10 days, or 1 gram for 5 or 10 days. So we give you that choice and then you choose the relevant one and that will prescribe it. So, on some of those, it's going to give you various kind of dosages depending on, what's going on. So it will put that in as well, which is quite useful. This is good as well with regards, because if they were, so it's aged 1 month and over, but at the point of you doing that, can you see it says, right, this patient's over 12. So the protocol will kick in. So if they were a 9-year-old or an 8-year-old, it would give you the relevant dosages for that age automatically. So you don't have to go finding that either, which again is really useful. You can't really go wrong because it's kind of doing the legwork for you. So again, that's that. And then again, the referral tab. So, if we had to refer, especially with a sore throat, it might be something, it keeps reoccurring. We need to probably refer for more advice or something. The referral page is going to give us the different types of kind of, kind of criteria for tonsillitis or whatever it is. So again, we could just go through this, and again, we've got the grayed out bit. So, do they have, a history of any of these things, or, if for a tonsillitis, recurrent acute sore throat due to tonsillitis, yes, it's really disabling for them and it prevents normal functioning. Yes, it does. And then how many have they had? Has it been 7, 5, or 3? And what's really nice here is, can you see at the bottom at the moment, because I've not ticked those, the criteria has not yet been met. So even that's prompting me, depending on what I choose, if I tick 7 or more, then the criteria, shared decision making, risk of surgery versus active monitoring, yes, we're going to do a referral after having a chat with the patient. So again, depending on what you tick, it's going to say whether you've met that criteria. But again, without getting into nitty gritty, it kind of makes sense. You go through, answer the questions, it's going to give you the answer. So that's just an extra page on that one. And again, resources page, just like before, those preset messages. So again, just works quite nicely. It flows in a similar way. So let me just come out of that one. And then just the last one I wanted to show you was the one for kind of gastroenteritis. So again, we've got 2 separate ones, adult or child. I'll just go into the adult one for now. But the only reason I wanted to take you to this one is there's one extra tab on this one. So again, look, home page, and across the top, we've got acute again, consultation, exactly the same order. but this time there's actually a results follow-up tab. So let's just say, we've done that initial acute consultation, we've sent off some results, the results have come back, we can then interpret those results, then come on to here and start answering, and it will get the guidance depending on what those results are. So you're not just using it for that first acute consultation, we can use these templates for follow-ups as well depending on the condition that they've got. So again, I probably don't need to go through this one bit by bit. Have a play, and it's all on the support articles and flows a similar way, but you can see how that would kind of work as well. So it's just knowing that's on there. Again, formulary is the same, but obviously just the guidance on the gastroenteritis, referral, do we need to refer for it, the guidance, and the resources page. So again, hopefully I'm making that kind of clear how it mirrors the other kind of templates. Now, just before I finish, I just want to talk about one other thing with regards to these templates and how you access them. So I've shown you how to get to it on the F12 launcher, which is great. And to be honest, a lot of you will probably just use, you can add as you go along. Some of you might use the doctor's bag. So I just want to quickly show you how you can actually access these templates from the doctor's bag as well. So, and again, we've done separate webinars and things on the doctor's bag, so I don't want to go into too much detail, but when you've got a patient open, a lot of you probably might use this, this doctor's bag under the patient's name, which is on every single patient, which is like the general consultation template. So if I click on this, it's a kind of a bit more broader with regards to why patients come in for your acute kind of consultations, and you've got tabs across the top depending on why they've come in. So if I just went to the respiratory tab, this might just be, you don't know why they're there, they start talking at you, and you might use this template. You don't have to go in this way first. I just wanted to show you those that are using this, how you could get to those infections templates. So they might be filling this out, what's wrong with you, let's have a look, let's take your blood pressure, etc. When you get to the diagnosis bit, some of you might have noticed there's a button to the right that says possible conditions. So the idea here is if they started talking to you, go, this is an acute cough, and you want to access the acute cough template, for example, if we click possible conditions, it will then suggest, well, what possible respiratory condition is it? So it could be any of these things, but you'll notice in the middle, it's alphabetical order. You've got one for infections. So if we click infections, then it will say, what infection is it? And look, I've got a few, but I can go acute cough, and that will open the acute cough template that I showed you at the start of this webinar. So it's the same, it's just another way. And again, you don't have to go in that way. I just know that some of you might be using the doctor's bag and you might think, actually, how does it integrate into that? You have the ability on each of those tabs to go to possible conditions, infections, and it will suggest the relevant infections for the tab that you're on. So in this case, acute cough, and then we could complete the consultation that way. So, you don't have to duplicate any data or anything. I just wanted to show you how you could access that as well. It's just worth knowing. I might stop talking. Is there anything from you guys, Emma or Charmaine, with regards to Q&A?
Might be worth just mentioning some of the questions that we had. So we had a question around, can you create your own presets to make it more personal in Ardens? So Emma said she is going to take that back to the development team. Is
that with regards to on the resources page and sending the text and stuff? Yeah, I think so. Just to show you something with regards to how you can use it. Let me just bring up the acute cough one again, for example. So there is the no preset message button. When you click on that one, it will just bring up the communications annex. This is something, it's something obviously we can build and have a look at doing, but I just wanted to show you that there are kind of presets that people can create locally if they did want to, and they would still be able to embed those onto that. So that's not something we can do, but as a training thing, if they wanted to have like a preset with a link to another leaflet that they find useful, they could do that, and they can create presets. I won't go through building a preset because that's another thing altogether, and that's SystmOne functionality. But if they click on this, it will give a list of the presets they've got set at their organization. So if you have any other preset, you would be able to do it from there. So yeah, just more FYI.
Thank you. And we had a question around what our formularies are based on, which actually we had the same question for our EMIS one, whether it's national or local. So both myself and Emma confirmed that it's national guidance it is following. So hopefully that answered your question and is useful for everyone as well. Now we had a response back from the presets, and it's more around not the resources page, it's the history and the management plans.
I see. Yes, sorry. it's quite tricky. So with regards to SystmOne functionality, only we have control over what we can put in the presets. If we opened it up to everyone, you would see like 1,000 versions of the same thing. It's the way SystmOne's coded, if that makes sense. So it's a bit tricky, but like we always say, if you think there's something missing that should be in that preset, then do let us know. And I'm sure you guys have said that already on the chat. So yeah, there's ways around it, but it's not something we can get practices to create themselves, unfortunately.
Thank you. No other questions to discuss. Is there anything more that you wanted to show before we break up for verbal questions?
No, I don't. I think that is kind of everything with regards to, again, kind of running through those, get to them on F12, nice and simple, and you can get to them on the general consultation bit. So yeah, perfect. I'll bring up the slides for, so just so you all know as well, like on the slides, we will share these slides afterwards. So I'm not going to go through these bits now, but we've got screenshots of a lot of the stuff that we just covered as well. So, I'm just going to skip through these now, and let's EMIS and SystmOne for these ones. But this is just some of, example of the template. So you know what we're talking about with regards to what we've covered. Including like the resources and stuff. So, these slides will be sent round to everyone. So you've got those screenshots. So I think just going forward with regards to kind of additional training and support, training is free. So do let us know if you just want training for your practice, and it doesn't have to be for your practice. It can be from a ICB or PCN level as well. We're more than happy to kind of do bigger groups like that. Do get in touch with us. If you scan that QR code, it will take you to a page on our website with loads of useful links and resources to, things like our Ardens Academy, where there's loads of like interactive guides, and you get a certificate at the end of those as well, which is really nice. And loads of kind of support. As I say, I don't know where we've put those things, but we will email out the kind of links to what we've covered today with the slides anyway. So don't worry if you can't find those. We will send them to you. With regards to that, but yeah, but training is free. We're happy to kind of go through it. It doesn't even have to be about this, it could be about anything, but just so you're aware. And I think just lastly, unless we've got any Q&A, I don't know if anyone has any other questions. Gone too far. So if you've got any feedback, and it doesn't even have to be about the webinar, just about the resources in general, whatever, it's really nice to know this, to get this feedback, to make sure we are doing what you need, and any ideas or anything. So do let us know, and if you scan that, that feedback is welcome. Are these useful? Are you using these resources? And anything at all, and it's really helpful for us to know. So do scan that to do that, and just other things like I was talking about. We're going to be doing more national webinars in the new year, especially with like a more clinician focused approach. So a lot more kind of webinars like that. So even if there's an idea for could you do a webinar on this or that, then let us know as well. We'll be more than happy to look at that and provide you with that as well in the new year. So yeah, let us know. I don't know if there's anything else. If you
want to verbally answer your question, if you just raise your hand and then we can unmute you. And while we're waiting for any questions, if there are any, we had a question around our patient info leaflets. Is there any provision for other languages within those? Emma, anything? Can you answer that one at all?
At the moment, we've just got the target leaflets, and we've got obviously links to NHS and patient info, which are the two big patient leaflet websites. So currently we don't have other languages specifically as PDFs within the template. But again, if there are particular, if you've got particular resources that you would like added or you think would be useful, please do email us. Charmaine, have we got an email address we can put on the link? The support at Ardens, is it?
Yeah, I think that's probably the best
brilliant
one.
Yeah. Please do, send them in and we can review them and consider adding them. But yeah, anything you think would help and improve these, we'd love to see. Thank you.
Thank you. Got a question. When we issue backup antibiotics, are these getting coded on SystmOne, allowing us to run audits later on? So probably a question for both Nathan and yourself, Emma.
Yeah, they are.
Yeah,
so they are. They've got
ticket, isn't it? Yeah, sorry.
As I say, they've got the deferred antibiotic code, the SNOMED code. So, and there's also another code, which is when you give the deferred antibiotic and you also give the target leaflet, and that's actually a new SNOMED code. So that's also in there as well, so you can audit both of those.
Amazing. Thank you. Well, we've had no hands up, so you must have answered all of the questions, Nathan, as you've done your demonstration. So thank you. Don't think we've got any further questions in the Q&A. Do let us know. Remember, you can always reach out to our support team if you have, this is not it. If you want some further support, then email us at support@ardens.org.uk. Make sure you get some training booked in. If you want us to come and train your clinicians, perhaps you're a practice manager on the call and you want us to go and train your clinicians, then we're more than happy to do that as well. But that's it from the Q&A side. So thank you, Nathan.
No, thank you. Yeah, I think we'll wrap that up then. But yeah, as Charmaine said, let us know if there's anything you want us to help you with. And but yeah, thanks for taking your time at lunch today to join us. And we'll see you soon. Thank you very much.
Thank you.